Welcome to the Merit's Prescription Drug Overview. In this video, I'll be giving you an overview of the prescription coverage we provide to Merit's employees who are enrolled in the Merit's medical plan. Although prescription coverage is automatically included with your medical plan election, the prescription drug coverage is administered by Express Scripts instead of Cigna. To see your estimated cost for the next calendar year, or if you are not currently enrolled in the medical plan and want to look up your medications, visit the Express Scripts open enrollment site at express-scripts.com/merits. This site will be open throughout the calendar year as well, so new employees can access this site to look up their medications prior to enrolling too. Keep in mind that your actual out-of-pocket costs can vary throughout the year, depending on whether or not you have satisfied your annual deductible. The estimated cost you will see on this open enrollment site is based on the assumption you have not yet met your deductible. If you are currently enrolled in the Merit's medical plan, to see your estimated out-of-pocket costs for the current calendar year, or to determine if your medications are subject to mail order requirements, step therapy rules, or require prior authorization, go to express-scripts.com, log in, and select the Manage Prescriptions, then Price and Medication link. Express Scripts makes changes to their drug formulary each year. New drugs are added to the list of covered medications, some drugs get dropped from coverage, and some drugs change from one coverage tier to another. If you are currently taking any medications, you should probably review that list to see if coverage for any of them will be changing for the next year. For a complete list, go to meritsbenefits.com, select Prescriptions under the Health tab, and click on the link in the section titled Preferred Drug Formulary Changes. Keep in mind that drugs are also added and dropped frequently throughout the year, so this list is based on information known at the point in time it was created. Now I'm going to review some of the programs that are included with your prescription coverage. The first one is the Livongo Hypertension Program, which is available for those enrolled in the Merit's Medical Plan who have been diagnosed with hypertension or high blood pressure. The Livongo for Hypertension program is a health benefit that makes living with high blood pressure easier by providing you with a free cellular connected blood pressure monitor, a mobile app that gives personalized feedback, and one-on-one coaching. The monitor automatically sends your readings to the easy-to-use app. You will receive useful information and tips to help you stay on track that will help you manage your blood pressure and feel your best. Livongo coaches provide answers to your questions and advice on improving your health. You're eligible to opt in at this program at no cost to you. Express Scripts will notify Livongo of all covered members who have had at least one claim through the Merit's Prescription Drug Program for hypertension medication. Livongo will send outreach communications to you inviting you to enroll in the program. You can also contact Livongo directly to register and opt into the program at ready.livongo.com/merits/HI or call the Member Support Call Center as shown on the slide for additional information. For those enrolled in the Merit's Medical Plan who have been diagnosed with diabetes, we want to help you monitor your condition and remain adherent with your medication. You're eligible to opt in to the Livongo for Diabetes program at no cost to you. Once enrolled, you receive a free Livongo cloud-connected smart glucose meter, remote monitoring with real-time outreach within 3 minutes, driven by dangerous readings via phone, text, and email. Coaching by Livongo certified diabetes educators and Express Scripts diabetes specialty pharmacists, free unlimited Livongo InTouch strips and lancets, and the Mango Health app to help you stay engaged and earn rewards. Express Scripts will notify Livongo of all covered members who have had at least one claim through the Merit's Prescription Drug Program for diabetic supplies or medication. Livongo will send outreach communications to you inviting you to enroll in the program. You can also contact Livongo directly to register and opt into the program at join.livongo.com/merits/HI or call the Member Support Call Center as shown on this slide for additional information. The last program is the Save on SP program. Merit's partners with Express Scripts Save on SP program to help members save money on certain specialty medications. If you participate in this program, approximately 150 select specialty medications will be free of charge. These prescriptions will continue to be filled through Accredo, your existing specialty mail pharmacy. If you are currently taking or will be taking one of these medications, you are eligible to participate in this program. Enrollment in the program is voluntary. Keep in mind, though, that if you choose not to participate, you will be responsible for a significantly higher cost which will not be applied to your deductible or out-of-pocket maximums. Express Scripts will send a letter to all members who are currently receiving any prescriptions from Accredo that are included in the Save on SP program, which will include information about the program and steps to enroll. If you are currently receiving specialty medications through Accredo and want to see if they are part of this program, go to meritsbenefits.com, hover over the Health tab, and select Prescriptions. Click on the link for the Save on SP medications. The deductible will be waived for most medications taken to treat the conditions shown on this slide, referred to as Preventive Plus. If you take an antidepressant that is not on this list, you will have to satisfy the deductible before the plan starts to pay. These medications are taken to prevent certain medical diagnoses from developing into more serious medical conditions such as heart disease or stroke. Medications to treat these diagnoses are not covered at 100%, as the ACA required preventive medications are, as we will discuss on the next slide. However, we are permitted to waive the deductible for these drugs. Affordable Care Act, or ACA, requires certain medications to be classified as preventive drugs and covered by the plan at 100% with no cost to the member. Those drugs are listed here. You will see that only low to moderate doses of cholesterol-lowering medications are covered at 100%. If you take a high-dose generic or brand name version of a statin medication, you will pay the standard coinsurance as described on the next slide, but the deductible will still be waived. The chart on this page shows the percentage you will pay for your medications, subject to the minimum and maximum copays once your deductible is satisfied, or if your deductible is waived because they are on the Preventive Plus list. The Express Scripts Patient Assurance Program sets copay limits on certain preferred brand glucose-lowering drugs and insulin products at a $25 copay for a 31-day supply, or $75 for a 90-day supply. If your medication is on the Preventive Plus list, in addition to waiving your deductible, you will pay the applicable coinsurance percentage listed on the previous slide for your medication, subject to the minimums and maximums. If your medication is not on the Preventive Plus list, you will continue to pay 100% of the cost of your medication until your annual deductible is satisfied. However, once the deductible is satisfied, your cost will be 20% for generic, 30% for preferred brands, or 40% for non-preferred brands, subject to the minimums and maximums. If you have prescription drugs filled through Accredo, Express Scripts Specialty Drug Pharmacy, you'll need to satisfy your annual deductible before the plan will pay any portion of these expenses unless your medication is on the Save on SP drug list. Refer back to the prior section on the Save on SP program, which we discussed earlier, for more information. If you don't qualify for any copay assistance programs and are struggling to pay for a full 90-day supply of home delivery medications, contact Accredo or Express Scripts to see if you can pay for your 90-day supply of medication in 3 monthly payments. The plan also continues to require most maintenance medications to be ordered through mail order or home delivery after the first 3 fills at the local pharmacy. On the 4th fill at the local pharmacy, the drug will be denied and you will be charged full price. The cost you pay will not be applied to your deductible. The plan continues to have step therapy and prior authorization rules for next year, which means that you must receive approval for certain medications. Step therapy rules require your doctor to prescribe a different covered medication for you or to confirm that you've already tried that medication before certain other drugs are covered. Prior authorization rules require your doctor to request approval from Express Scripts for certain medications by providing specific answers about your medical diagnosis and other required information. For certain injectable medications for which the doctor places an individual order for you to have injected in their office, the medication must be ordered through Express Scripts or Accredo for specialty medications instead of through Cigna's pharmacy in order to be covered. If you will be receiving an injectable medication from your doctor's office, contact Express Scripts or Cigna to ask if this is a medication that needs to be filled through Express Scripts. If your doctor has already requested the medication through Cigna and you receive a denial stating the medication is not covered, contact Express Scripts to ask if the medication is covered if ordered through them instead. All gene therapy drugs must be received and processed through Cigna instead of Express Scripts in order to be covered under the plan for those drugs. If you receive assistance for your out-of-pocket prescription costs from a drug manufacturer, the amount or discount applied as part of that manufacturer assistance will not be applied to your deductible or out-of-pocket maximum, since those amounts are not paid out of your pocket. That concludes our overview of your prescription drug coverage. If you have questions after reviewing this, contact Express Scripts at the number on your prescription drug ID card or the Merits Benefits Department at 636-827-4088 or email benefits@merits.com.